We are now going to demonstrate the VOMS, or the Vestibular Ocular-Motor Screen, which we use clinically to assess athletes following a concussion. The VOMS consists of 5 different tests, including smooth pursuit, Qods both horizontal and vertical, convergence, VOR assessment both horizontal and vertical, and visual motion sensitivity testing. As we go through each of the tests, we are asking the athlete what kind of symptoms they are having as we do each of them to determine a more clinical intervention to help the athlete recover from their concussion more quickly. The first exam that we're going to do is smooth pursuits, where we're observing the tracking motion of the athlete's eyes. So the athlete will stay focused on a target and keep their head still and follow the target with her eyes. You will ask if they have any symptoms as you go to their end range of motion of their eyes. Oftentimes, if they are concussed, they will have pressure or pain with that end range of motion. Does that feel okay? Mm-hmm. Good. The next assessment that we're going to do is horizontal saccades. So you'll have 2 sticks with targets of 14-point font. She will hold them out in front of her at about a distance of 3 feet wide. You will instruct the athlete to keep her head still and have her eyes focused on one of the letters. We will start a timer for 10 seconds, and we will track how many cycles she is able to move her eyes from left to right. So 1 cycle is when she goes from the left stick, right stick, and back to the left stick. And we will count how many cycles she can perform in 10 seconds. Are you ready? Mm-hmm. Ready, go. Good. So you'll note how many cycles she was able to complete, as well as any symptoms that she may have had during the exam. The other thing that you want to observe is see if she has any overshooting or undershooting of the targets when she is performing the test. Now you're going to turn the sticks, and we're going to do vertical saccades. And so she's going to start at one of the sticks, and again, her head will stay still and her eyes will go between both targets, and you're counting cycles over the course of 10 seconds. Ready? Go. Good. And you want to make sure to instruct the athlete to go as fast as they feel comfortable. Oftentimes, if they are very symptomatic, these will not feel very good and they will tend to pause and go a lot slower. This is also different from the 2014 article, which recommends doing 10 repetitions of each of the exams. We do 10 seconds for time because then we use it clinically to perform interventions and exercises for them to do at home. The next examination is the convergence test. So what you're doing is you're having the athlete follow a target and tell us when they see a blurry target. Tell me when it gets blurry. Blurry, good. What you will do is you measure the distance from the target to the tip of the nose, and normal is 5 centimeters or less. We also then repeat the test and have her tell us when she starts to see double vision. She does fairly well, and that would be a 0 centimeters. That is an indicative test. If she does have difficulty focusing or if the convergence test causes her symptoms, then we will probably restrict their ability to read until that improves. The next exam that we're going to do is a VOR assessment, both horizontal and vertical. So she's going to hold the stick in front of her, and then there is 1 target, and she will keep her eyes focused on that letter. What she's going to do is she's going to shake her head left and right about 20 degrees in each direction as fast as you feel comfortable for about 10 seconds. When I say go, go ahead and turn your head left and right, but keep your eyes focused on the target. Ready? Go. Again, we are counting cycles of motion. Good. How do you feel? Good. This one can be a very provocative movement for patients who are concussed or athletes who are concussed, so just give them some time to recover in between exams if they do feel particularly dizzy or an increased headache after the test. The next exam that we're going to do is a vertical VOR. So again, hold the stick out in front of you. This time you're going to nod your head up and down like you're saying yes. Again, you're going to go as fast as you're comfortable, keep your eyes focused on the letter, and we're going to go for 10 seconds. Ready? Go. Again, we are counting cycles. Good. So again, you're going to note any symptoms that they may have had. Additionally, when you're doing the VOR testing, because of neck involvement, if an athlete does have cervical involvement of their concussion, that may compromise the test. So you want to distinguish between symptoms when you're doing the assessment. The final test is the visual motion sensitivity. So you're going to hold the stick out in front of you, and you want to keep your torso still. Your eyes will stay focused on the target, and you're going to rotate. Every time you hear a beat, you're going to turn about 80 degrees to the right, come back to the center, 80 degrees to the left with the beat. Ready? Go. Good. How do you feel? If this is provocative for an athlete when you are testing them, this may be indicative that they may have trouble moving quickly in cars or with following objects when they're tracking. The VOMS that we do in the clinic is adapted from the VOMS article of 2014. That one does request that you do 10 repetitions of each of the assessments, and then also request that the VOR is done at 180 beats per minute. We have found that clinically that may be a little bit too fast for the athletes who have recently been concussed, which is why we do it for a time and then use that time to help identify appropriate speeds for them to do the motions at home so that they can improve and resolve their vestibular or ocular symptoms.